I think the overwhelming feeling at the meeting was a feeling of excitement about surgeons being together in person, interacting face to face with one another, and that was really reflected through the whole meeting. There was incredible energy around the meeting, a lot of engagement. I think the lecture halls were filled with surgeons finally having a chance to talk and hear information directly rather than through a computer monitor, and a lot of interaction with industry, looking at new technologies that I think we've largely troubled to get our hands around over the last year with COVID and Zooms and the world we've lived in. I think we've refocused on innovation, which is sort of what ISASS was originally developed and formed around. And I think that was reflected in the annual meeting. I think we're also, as I say, emphasizing the international component of ISASS. And as I say, despite the challenges of COVID, we had a significant international presence there, although obviously with the restrictions on travel, not as robust as we would have liked and we had planned. So I think with the challenges of COVID, we were able to kind of refocus on the mission of ISASS. We had a lot of time, or more time than usual, to really reposition ISASS to accomplish these goals. Personally, I sort of have an interest in minimally invasive surgery and technologies that enable that. I think personally I've seen and I'm interested in the ability to apply minimally invasive technologies for more complex spinal problems. I've, in the last few years, been involved in and am intensely interested in enabling technologies like augmented reality. I think we've been using it in our practice for the last year. I think it's getting a lot of interest and traction. And I think that's an area we're going to see expanding in terms of enabling spinal procedures, and particularly minimally invasive approaches to more complex problems. I think also seeing artificial intelligence and machine learning is really finding its place in spine surgery and developing rapidly. And that's another area I'm personally involved in and interested in. And hopefully we'll see an expansion of that to allow us to take better care of our patients in a more reproducible, predictable way.